एक सेकंड। रख दे उसको, मैं इस पे कंधे पे रखूंगा। बस 2 मिनट में थोड़ी बंद कर।
Here you see all the muscles on the pelvic floor. Today we are doing pelvic floor muscles, knee muscles to understand better for better treatment. So where you put needles and how you put needles and how you correct it. If you see this picture, in this picture everything is very clear. Both pelvic floor leg bone on a level. Okay. When there is any disturbance, then on this bone, L5S1 joint is compressed. If pelvic floor is going right side elevated or left side elevated, then one side is contracted and one is lengthening. Due to this, you see this gray color matter. It is the disc. That you read in so many conditions, that disc bulge, disc protrusion. So it is a stabilizer between two bones. Here, this bone is T12. Here you see 12-3. Then this disc is called T12L1. Then this called L1, L2, L3, sorry, L2, L3, L3, L4, L4, L5. This. Then this is the L5S1. So in most cases, you see in MRI, then they write there T12 L1. This. Okay. This part. So if you see this iliac bone level in this picture, it is equal. Sorry. If I draw from here, then you see it is equal or not. And if I draw a line from here, then it is also straight. Whenever you see any patient that have incorrect posture, elevated pelvic floor, depressed shoulder, then it is creating disbalance here. If it is elevated on one side, then its shape already change like this. It is cause of disc bulge and nerve compression. In so many conditions, you read there is osteoarthritis, osteophytes. That is bony structures here. It is up and down like this. Then it is not equal. Then another thing you read. What? Disc decompression, disc thickening. In that, this gap of between two vertebrae, it is reduced. Then prolapse. So prolapse is nothing but when this bone is giving in a pressure, then on another side it is blessed like this. Then it compresses the nerve. And most important, I tell you every time for lower limb, the muscles is the iliopsoas. So here you can see this muscle is psoas major, and beneath it there is psoas minor. That is coming. Okay. Joining with the pubic. So here you see the nerve in this triangle. Here is a triangle. You see this triangle? Muscles triangle. It is sartorius. Then it is muscles pectineus. This muscle is pectineus. And on this level, it is making a triangle. So here is three things: nerve, arteries, and vein. When a patient have tight iliopsoas, then it is compressing the femoral nerve. That is the cause of pain. And it disturbs other muscles. So if I show you one demonstration, then not now. If I lay down in my bed, if my iliopsoas is tight, 1 minute. If my iliopsoas is tight, then my leg condition is this. It is not fully straight. Okay. Another hip, you see this leg, opposite leg, if you see, then it is very straight. But on left side, it is tight. Because of this, it is going this up. Then you release these muscles. How you release? Take leg like this, then press from here with this moment. And it is painful for every patient. After releasing these muscles, he got too much relief. And leg is straight. Okay. So it is necessary to release psoas muscles. Then biceps femoris. I tell you yesterday about one compensation pattern. In that, the leg is going like this up. Why it is going like this? Because iliopsoas is also tight. and biceps femoris. That is a flexure of the knee. And when it is tight, then it is flexing the knee. So you release both muscles, psoas muscles and biceps femoris. Then you release these muscles and lateral side, vastulis lateralis. In same position like this. It is a manual technique because on this area, if you see, then it is totally which meridian is here? Which meridian is here? Stomach meridian. So you apply pressure on all the stomach meridian points while you are doing this, rotating this type. And it is giving a very good result to your patient. And it increase your clinical practice. My voice is not clear. So it is the part of a therapist how we recognize the muscle's weakness. What is the symptoms when a muscle is weak? So if you see in this picture, then you see it is called these muscles. If I am going with colors, then these muscles, sartorius, and it is called a talar muscles. Okay, then this muscles name rectus femoris. It is a strong extensor muscles of the knee. When this muscle is strong, when this muscle is strong, then immediately anyone can straight the leg. Then these muscles are adductors of the hip muscles, adductor of the thigh, adductor of the hip, all these. Okay. Then these muscles and these muscles also extensor of the foot. So it is vastulis lateralis and this is the vastulis medialis. And it is the patella. Then here is the tendon. Here is the tendon. This tendon, femoris tendon, then it is going through the patella. So it is called patellar tendon. Okay. Then if you see the arrangement of muscles, then Here you can see this is the tensor facial artery muscles that is starting from the hip and going down to the knee on the head of the fibula. It is joining with the head of the fibula. Then this muscle, sartorius, starting from the iliac spine and it is coming on the tibial. Okay. On tibia bone. So these muscles are two joint muscles. First, here you see greater truncator in this area. Here. Okay. So these are the front muscles. Then on lower leg, these muscles, tibialis anterior, then extensor digitorum, longus and fibularis longus on the attached with the bone fibula. That is called fibularis. Then on next picture, if we go, here you see how they are joining with the two joints. So here is the first joint of the femur bone and this is the second. Okay. Then next, all of we know which muscle is which nerve is this? You see in yellow color, which nerve is this? Here. This is sciatica nerve. This is sciatica nerve. Then if you see this muscles, this muscle is named piriformis. This is the muscle piriformis. When you are putting a purse in your back pocket of your jeans, and when you are sitting, then this muscle is pressing and taking pressure. Okay. So when it is tight, when this muscle is tight, then it is compressed the sciatic nerve. This symptoms called piriformis syndrome. I see and I realize most of therapists don't know about this piriformis syndrome. They know only one condition. What is condition? Sciatica. And in acupuncturist field, they are telling UB meridian sciatica or gallbladder meridian sciatica. UB meridian sciatica pain and gallbladder meridian sciatica pain. So how it is going? Show in next. See. So if a patient has sciatica nerve pain that is on the gallbladder meridian, then where it is disturbing? Which area it disturb? If there is gallbladder sciatica pain, It is crossing from here, backside of the patella, and joining with the point GB34, near to GB34. Then it is going towards GB39. If there is pain between GB34 and GB39, then you can call it sciatica nerve pain with the gallbladder meridian. If on the thigh, if there is pain, that is not sciatica of the gallbladder meridian. The pain because of tightness in iliotibial band, tightness of tensor fascial artery muscles, not because of sciatic nerve. In this picture, if you see, this is sciatic nerve and it is coming down with centrally. Here it divides in two parts. Then it is called fibular nerve because it is attaching with the fibula and going through the nearby the bone fibula. Then another part of these muscles is called tibial nerve. It's called tibial nerve. That is going between two muscles, tibialis anterior and tibialis posterior below the knee. Okay. If you are going in the this part on thigh, back of the thigh, then it is purely gallbladder, urine bladder meridian pain. You can call it urine bladder sciatica pain. If the pain is starting from the glutes region and it is coming till knee pain, till knee, then another relationship I told you on this junction with the back pain. Which point is here? Which point is here? Write down. Write in chat box. Which point is here? Okay. UB40. Then which point is here? UB39. Okay. So I am telling you one real thing that is very helpful for you. If you find any purple vein, any purple color veins near, not bluish vein or not green vein, only purple veins. Okay. Then you find these forefinger up and forefinger down to the crease of the popliteal fossa. Here is one crease. Then forefinger up and forefinger down. If there is any purplish vein and you do bloodletting on this vein, the back pain, psoriasis, skin disease, asthmatic problems, urine bladder related problems, reproductive organs related problems, all are cured with this point. If you are bloodletting here, I am not suggest you that you do bloodletting on exact on UB40 because it is near a artery, and if you do bloodletting on this area, and by the default you prick artery, then it is a big problem for you. Sometimes it may be hematoma, excessive bloodletting, inner bloodletting. That a cause of that may be a cause of severe pain on the knee area, swelling. Okay, so never do bloodletting on artery area. Okay, approximately remain this area. On another area, you can bloodletting. Okay, from center to center, let it. In my back pain patients, approximately I do bloodletting on every patient. In my webinars, in my seminars, offline seminars, I always do bloodletting on these points. And I think here is Dr. Mohinder Singh ji. डॉक्टर मोहिंदर सिंह जी, सत श्री अकाल बाबा जी। सत श्री अकाल बाबा जी। अपने आप को अनम्यूट कीजिए।
हेलो।
सत श्री अकाल बाबा जी।
सत श्री अकाल जी।
मैं चाहूंगा कि आप अपना अनुभव शेयर करें UB40 एरिया की ब्लीडिंग पे, जो हमने आपके ऊपर दिल्ली के सेमिनार के दौरान की थी। तो उसके बाद आपको क्या क्या बेनिफिट मिले?
देखो, इधर जो ब्लड लेटिंग करने से मेरे को फायदा हुआ, जो मेरी ब्लैकेट थी दैट वाज ड्यू टू L4 L5 space reduce, L5 S1 space reduce prostitution with nerve compression, ये ठीक हो गया, प्लस सटिका भी ठीक हो गया। उसके बाद जो मेरे को फायदा हुआ, मेरे को वेरिकोज वेन था जो टांगों में, तो वेरिकोज वेन में भी 75% फर्क पड़ गया था।
इसके बाद जब आप होटल में जब सीढ़ियां चढ़ते थे तो क्या कंडीशन थी, और ब्लड लीटिंग के बाद जब खाना खाने के बाद दोबारा आप ऊपर चढ़े तो क्या कंडीशन थी?
हाँ, तो बहुत इजी हो गया था, बहुत इजी। उसके बाद मैंने खुद भी ब्लड लेटिंग किया वीकली, तो वेरिकोज वेन जो है वो प्लस मेरा जैसे सटिका चढ़ने में उतरने में मेरे को दिक्कत जो है 90% ठीक है। अब मैं बिल्कुल ठीक हूँ। आई एम सेवेंटी
अभी
वन
आप
ईयर्स
कितने पेशेंट्स पे करते हो?
मैंने तो देखो जी, नंबर ऑफ एटलीस्ट 30 to 40 पेशेंट्स पे कर चुका, एंड रिजल्ट्स आर मिराकुलस एंड इमीडिएट रिजल्ट।
ओके, थैंक यू सर।
थैंक यू, गॉड ब्लेस।
तो
यू आर
डॉक्टर
रियली
मोहिंदर सिंह जी आर माई well
You are,
wisher, and I respect them as a Babaji and as a guardian to me.
I am your student, sir.
They meet me in Delhi
You are
seminar.
really, you are really, you are really doing selfless service to the humanity. You are teaching us further, further when we got the result, their good wishes also goes with to you. So multiple good wishes you are getting. You are really आप सेवा जो कर रहे हैं ह्यूमैनिटी की कर रहे हैं.
They meet me in Delhi seminar.
Okay.
Then they tell me I have very severe pain in back, and when I am climbing the stairs, I have so much pain, and we are living in an apartment on third floor, and it is very difficult for me when the lift is not working. So what you do? Then we perform bloodletting. When I see their legs, they are fully purplish on this area. After removing bloods, they got very good results. After that, whenever they have problems, they do bloodletting themselves now. And now their age is approximately 78 years.
Sir, can you please repeat where to do this bloodletting and where to avoid? You said artery means how to find out the artery at this area?
Artery on the center area. Here you can see artery location. Red color is artery. If I remove my colors, you see, here is the artery on the center area. Then near it, there is vein. Then there is the nerve. Okay.
So we have to bleed only the.
These three things between UB40 and UB39. Then if you want to bloodletting this area, then only bloodlet purplish vein, not other color veins, only purple veins. Okay.
So purple area
And
only between UB 39 and 40 only. Or little below and above that also.
yes, yes. Only the arteries are between these 2 points.
Okay.
Okay. I am telling you artery location and nerve location and vein location on this area.
Okay, sir.
Okay. You can perform bloodletting 4-finger up from the popliteal crease. It is the popliteal crease, and 4-finger down. Then second point I am covering here, and that is ST36, 37 and 40. Between this area, if you find any purplish vein, anterior side of the lower leg, on the tibialis anterior muscles, okay, you find any purplish vein, and if you do bloodletting on this, then it is very good for treating all type of stomach problems. It is very good for stomach pain, and it is also good for knee pain. So I suggest you, whenever you find a patient who have purplish vein, back of the knee, front of the knee, 4-finger up, 4-finger down. Then 36 to 40. If any purple vein you find out, then bleed it. Then you have very good results. I am sure with my practice, I am sure with my results. Okay?
Okay, sir. Thank you.
Hello, Prof.
Yes.
I think the artery is the red this thing beside the
Yes, yes.
blue line. Okay.
Blue is
Thank you,
the
sir.
vein. Blue is vein. Yellow is nerve. If you read any book or any textbook, then keep in your mind, yellow is the nerve, blue is vein, red is artery. In all medical science books, the same protocol is given. Okay?
If it is varicose veins, sir, can we bloodlet also those
No,
in those
no, no.
videos?
In varicose vein, I never advise you for bloodletting. Where the varicose vein exactly are bold, then don't bleed there. On digital area, you can bleed it.
Okay, sir. Thank you.
Almost varicose veins are on the area of the gastrocnemius muscles area between the points QB 54 and 58. Almost in patients. This area is commonly used and seen for varicose vein. But if you want to treat, then you do bloodletting on upper thigh, above the knee, on this area. Okay?
So we have to do the bloodletting in the distal acupuncture points of this varicose veins area. Am I right?
Anywhere when you find purplish spider veins, perform it. Because when you are bloodletting on this area, you recognize this area, sacral and coccyx and the, okay, on sacral area. If you are bloodletting on in this area, then it is very good for treating head pain, migraine, then vomiting sensations that are not stopped after pantoprazole, omeprazole, NSAID. Then you can use this bloodletting. It has very good results. Okay, from sacral to coccyx area. So this is the area of sacral. Okay. Then in this area, if you find any purplish vein, do bloodletting. If you are treating for head pain, neck pain, vomiting sensations with vertigo, okay, then you perform bloodletting on this area by amber taping, okay, or with lancet. There is so much good results. I am telling you my own experience that I am using in my clinical practice. And every time I got very good results.
Hello, Prof.
So, yes.
Please, my network just went off.
Dr.
Please, if you can repeat.
Dr. Nancy Moss. I
No,
know.
it's Dolly. It's Dolly.
Okay, Dolly. So we
Yes.
provide you recording, don't worry. It is not
Okay, it's
time for
recorded. All
asking
right.
questions. Okay. So here you see,
Hello, sir. Hello, Prof.
yes.
Before you move forward, about that sciatica nerves, you made mention, maybe if you can scroll up so that I'll be able to tell you what I wanted to hear. You made mention of these nerves. You said why the nerve is so, tight is because of the sitting. Is there anything one can do when sitting down in order not to injure the nerves there to cause sciatica pain, because it's very painful, whoever that has it? Is there any solution to it? Because you made mention that is when they were sitting, they sat on that nerves, that sciatica nerve, the way it's been, pictured here. Is there anything that can cushion it so that they will not sit direct on it in order for it to be tightened, sir? Thank you.
So I told you why it is very painful to patient. Because we are not finding the purple vein and we are pricking the greens or blue veins. Then it is cause of pain due to excessive hematoma, and the pain automatically gone after 2 or 3 days. It is painful, but after 2 or 3 days, it is also giving good results to the patient. If by mistake it is happen with you, and if your patient is saying to you it is not good, I have so much pain, then give him a word, wait for 3 days, you will get good results. And definitely he got good results. I am not saying you puncture the veins, arteries with your will. No, never. Never puncture these things. By mistake, if it is happen, then don't worry about it. Okay. Then another area you see here, the lateral side of the muscles. So sorry. This is the iliotibial band. When this band is very tight and it is contracted, then we have a valgus knee. Because it is pulling the lower leg towards up. Because of that, on lateral side, there is much pressure on the knee, and on medial side, there is the gap. And it is called valgus knee. Okay. And glutes maximus and tensor fascial artery. Both tendon are meeting and it is called iliotibial band. ITB band. ठीक है? Okay. Then cross section. Here is only single muscles that you can see. Then there is lower leg. On lower leg, if you see, then what imaging with this picture you? This is the front side of the knee and it is the back side of the knee. Then if you see the relationship, gastrocnemius and biceps femoris, then they are attaching like this, fixing. Here you see these three muscles bend going down to this and this is going on up. So there is a great connection to stabilize the knee and gastrocnemius muscles have. So in every conditions, it may be valgus knee, it may be varus knee, quad dominance, anterior tilting, posterior tilting, in all type of conditions. Almost the most disturbed muscles are biceps femoris, vastulis lateralis, those are lateral. Then gastrocnemius lateral head, this head. Then peroneus longus on front side muscles. Then tibialis anterior. And then glutes medius, iliopsoas and adductor complex. Those are adducting the hip. Adductor magnus, adductor longus. So only these muscles are weak and strong in every conditions. So I gave you tomorrow a good PPT on all these points, how to treat these points with motor point, with the tongue points, with 10 points, with the TCM points. How you treat these conditions.
Thank you, sir.
Okay. And I request all of you, tomorrow you join and we hold the class for 2 hours and more than it. Because I want to share my knowledge. Because of that, I know my life is not permanent. So I want to share what I learn from the books and what I use in my clinical practice, so that you also survive the pupil, survive your good family and live with happily and with the happy patients and happy family. So I want to share all the things with you, but it is time is very less. Life is very beautiful, but time is very short.
That's true,
If we
sir.
have 500 years to live, then it is better. But in present era, because of bad foods, we are only thinking about in India nowadays, I told you approximately 75 is the highest age. In new generation, heart rate, you see heart attack rates, how much in all of your countries. If you go in Nigeria, then you see how many patients have in young age heart failure. In India, I am telling you very truly, if you listen Dr. Vimal Chajar, if you listen Dr. Mannu Bhai Kothari, they are the chief and dean of the colleges in King Howard's Medical College, Bombay. They tell the medical truth very openly. And now in India, every day, more than 10,000 deaths due to heart attack. In all over India, I am not telling only a city, all over India. It is the ratio of present time in India about heart attack. When any person going in the clinic, in hospital, he have gastric pain, the doctor told immediately you need a transfer, you need for angiography, you need for stunt, and they are taking money. So we are good doctors, we have no surgical equipment, we have no other harmful medicines, and we are giving a new life to a patient. And almost all of you are doing very great. I am so much thankful to all of you that you choose as a profession alternative medicines and acupuncture. Because in acupuncture, when you are pricking needles, it is giving so much good results to you. But a proper knowledge, a proper guidance is very necessary for this work also. So yesterday, someone is asking about plantar fasciitis. Then you see the muscles, adductor digiti minimi, pedis, these muscles. Then you see this Achilles tendon. That is going through the fingers. So what is happening when we have not a stable foot and not a good posture of the foot? Then it disturbs the all ligaments. Okay. When I watching this book, and I have so many ideas from so many books. In one book, I seen this band for massage, and it is releasing so many conditions. At that time, I am learning about foot reflexology. I am not now how it is working, but now I know very well how it is working. Because it is giving a relaxation to all these muscles and tendons. And the fascia relationship with this going to on upper areas. And it treats so many conditions. How many persons in you know about foot reflexology? Anyone there who know foot reflexology?
What did you say, sir?
Foot reflexology.
Foot reflexology.
Yes.
Well, it can be used as a massaging technique, sir, if I may be right.
Yes, yes. So on this area, I come to the point. So almost the pain is going on this area of hill spout. Okay. Because of hill stuck. So when you are putting the needles, yesterday I told you the point 11.27, point number 2 and 4. They are giving very good result for this condition. And that point is my favorite point for ankle pain and heel pain.
Excuse me, sir.
Yes,
Is it on that 11.27 that when one needles, it gives the good result?
11.27,
Yes, sir.
point
That's what
2
I'm
and
asking.
4 for plantar fasciitis and heel pain.
Okay, sir.
Okay.
सर myself
Yes,
दीपाली सर जैसे अभी मुझे पंचर तो नहीं आता एक्यूपंचर करना बट अगर सेम प्लेस पे जैसे मेरे बेटे को दर्द हो रहा है तो व्हाट कैन आई डू
you can do massage, no problem.
ओके
On plantar
सिंपल
fasciitis, we have heel pain.
सर उसको हील पेन हो रहा है
Okay. So you can massage the thumb here.
ओके फाइन सर
Okay. On this area.
Where, Prof?
फाइन फाइन सर ओके
Okay. On this
यस
area.
ओके थैंक यू सो मच सर
That is the dorsal area, sir.
Yes, yes, dorsal area.
Okay, thank you. Sir, to needle the dorsal area for which problem?
Which needle? 11.27 for plantar fasciitis, heel pain, heel spur, heel bone spur. Okay. Then this is the main thing that I want to tell you. It is the myofascial lines. Okay. A minute. Yes. So in this, if you see, this is the front line of the fascia, facial plans. Okay. In meridians, myofascial lines. It is called meridians, myofascial lines. So this is the front line and this is the back line. So if you see in front line, then all the muscles you see joining with each others. We start from the foot's top muscles of the foot, dorsal muscles, okay, attach with the tibial muscles and peroneus muscles. Then it is joining with the quadricep muscles, then it join with the rectus abdominis, then it is joining with the supracondylar joint, okay, ligament. Then it is joined with the SCM, sternocleidomastoid muscles. Now we are going on back. Foot plantars muscles, then Achilles tendon muscles, gastrocnemius, then hamstring muscles. Then it is joining with the back extensor. Okay, here. All the back extensor muscles. Then it is joining with the skull and it become on the frontalis bone here. Okay. So from here to heel on back side, it is a single plane that is treating, and with this relationship, if I tell you about tongue acupuncture, then it is very easy. So in tongue acupuncture, you all know the 77.1, 2, and 3. 3 points are good point for neck pain. Why it is working? Because this facial lines attachment with neck extensor and with trapezius muscles. So it is releasing immediately. Okay. On another front side, I told you ST40, bleeding area of the ST40. From the point ST40, you go to chun lateral, to chun medial, and to chun up and to chun down. If you find any purple vein or any spider vein in this area, then you prick it. Okay. You prick it and do bloodletting. This bloodletting treat tumors, cholesterol, heart problems, all type of asthmatic problem, bronchitis, asthma, and pneumonia, chest congestions, excessive phlegm in the mouth. Okay. So ST40 area bleeding is so much useful in the condition of phlegm. Any type of phlegm. If you are going through the TCM diagnosis, then there is heat phlegm in liver, fire phlegm in the liver, okay, spleen, damp heat phlegm, all type of phlegm. The good point, ST40. And in Tung's book, a study on Tung acupuncture point, they told the Feng Long. Feng Long means the Chinese name of ST40. Feng Long's bleeding is very good for treating heart problems, lungs problem, and all type of mucus and phlegm problems. So you use ST40 area for bleeding. bloodletting. Okay. Then next plan, if you see, then this is the lateral line. In first picture, we see front and back. In this, you see the lateral line. So lateral line also going through the plantar fascia, then soleus muscles and the fibularis muscles. Then it is joining with the tensor fascial artery. Then it is joining with the intercostal ribs, and then it join with the sternocleidomastoid and splenius capitis muscles with a strong relationship. The lateral line is have a very good results. Why? Because it is the mediator of the two plants. It is the mediator of the two plants, superficial front line and superficial back line. If there is any type of imbalance, it tries to maintain it. And if it is fail, then there is compensation pattern. Become. Then fourth plan, the deep muscles of the front line. Fronts. So in deep, there is the, if you see all the points near the fibula and the area of ST40, GB39, GB39 area, 40 area, then the meridian area of SP, spleen meridian and liver and kidney meridians. So here is the point. If you see 88.9, 10, 11, those are very good point for treating all type of kidney, urinary and reproductive organ problems. Then on the same area, there is a point 88.11, 12, 13, 14. Good for treating all type of liver problem and gallbladder problems. Okay. So it is showing us a relationship with the fascia and the muscles. Then there is another line, spiral line. It is showing us the relationship with other muscles, each other muscles. If you see here, okay. If you see on this area, then if till now what you are understand with this plan, facial meridian plans, I am showing just you 4 pictures. Two pictures, front line, back line, then lateral line, then deep facial line, deep front line, then spiral lines, then arms front and back lines, then functional lines, that is functioning. So which system is showing you this meridians and collaterals? What you understand with this? What is the law of tongue acupuncture? What is the law of Dr. Tan's acupuncture? Richard Tan. Anyone tell me? If you watch this picture, then what you learn? Anyone?
Hello, Prof.
Yes.
What I learned is that there's a balance between the nerves, the meridians, and the organs.
Yes. If you see this picture, I am telling you now, if you see these pictures, okay, and there are three pictures. It is a lateral line, it is back line, and it is the spiral line. Okay. So when you are going in the tongue acupuncture system, then what is the condition of tongue's acupuncture system? First condition, top treat the bottom and bottom treat the top. So how it is treating? Just now I tell you, through the facial connection. It is the back line that is starting from here. You see? Then it is going on the here. Then it is coming on the front. On frontalis muscles. And on frontalis bone. So it is giving the truth of that concept. Top treat the bottom and bottom treat the top. And in my real clinical practice, I see whenever I put needles on 77, 1, 2, 3, it is treating head pain, neck pain. In that area, I tell you now, just now about coccyx bloodletting, sacral and coccyx area bloodletting. That also saying the same systems. When you are treating DU20 and you are putting needles with moxa, then it is treating hemorrhoids. Okay. And when you're treating the area of the coccyx, then it is treating the head pain and vomiting sensations, migraine, neck pain. Then left treat the right. So here you see this spiral line is going, then it is going to left. Then on circulate and it is going to right. Okay. Starting from left, then it is going right, then it is go back side, then it is coming front, left, then it is going right, down. So left treat the right, right treat the left. Okay. Then second condition, bone treat the bone. Bone treat the bone. Whenever you are treating the bone, then put needles near the bone. In tongue acupuncture, there are points, spine straight point. A 3 points combination just above LI11. First point is 2 tune up, then second is 2 tune up, then third also 2 tune up from LI11. That is called straight spine, and this point useful, very useful for the spine correction. In scoliosis, lordosis, kyphosis, you can treat with these points. Then how it is possible? Because the spine in middle and hand point is here. What is the connection? That I show you here. Okay, some connection you learn here. The next I show you on next picture. Okay, this is the line, back superficial arm line. You see, this is coming on the here. Then if you see this picture, then trapezius muscles, you see, starting from occipital protuberance and ending on T12. Okay, all 12 vertebrae, C7, then T12, controlled by the trapezius. And trapezius have a strong relationship with here. If you see on front line, on back line, okay, on the shoulders area. The points I tell you, LI11, 2 chin up, 2 chin up, 2 chin up. Then it is going here. Okay. Then how many vertebrae are corrected with this muscle? 12 and 7, 19. The remainings covering by these muscles. What you called it? Latissimus dorsi. Which muscles? Latissimus dorsi. Yesterday I told you, when the patient have shoulder pain, cannot drive for a long time, then this muscle is strong and not helping to raise the hand. So with this connection, the same, then it is coming on the sacral area. So remaining all the vertebrae controlled by these muscles. From T7 to sacral and coxicate, controlling all the things with the relationship of this. Trapezius is coming here. Okay. Then latissimus dorsi is coming here. Like this. It is joining. So because of this relationship, the hand points, back points, LI4, in tongue acupuncture, Lingu, Dabai, John Bai, Shobai, and 22.8 and 22.9, 22.04, 22.05. All points are good for treating back pain. Here is the connection. Here is the connection, scientific connection. Okay. Now you understand with this relationship or not? Any question from anyone?
I want it to be repeated, sir, if you don't mind, as per the connection of the muscles from the trapezius down to
with the sacral area. Thank you.
Any other question?
Yes, sir, Prof. Please, sir, also call the points that I just mentioned.
I already gave you the PDF.
Okay,
Already
now
I provide you PDF, but you are not watching in PDF.
it's okay, sir.
First you read PDF, then you ask me.
Is
In
the
this
PDF
class, you know,
provided in the group? Is the PDF in the group, sir? Which
yes,
group? I
yes.
don't know. Which group, sir?
I told you they are my Nigerian student.
Okay, 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 sir. Fine.
And they have a special group for Nigerian. Okay.
Okay.
Their class always starting from 9:30 to 11.
Okay,
It is
sir.
very difficult to join for you because it is our sleeping time.
Yes, sir.
I am
Is it a
managing very
course?
hardly.
Are you conducting a course, sir?
Yes, yes.
Okay. May I know the name of the course?
Our diploma course 1 year. Postgraduate
Okay.
diploma in acupuncture.
Okay, okay. So who gives the certificate? Certificate by whom, sir?
University.
Okay.
UGC approved university.
Okay, okay. May I know the fee, sir?
Now 60,000. 1 year.
Okay,
Complete. Then you can join offline seminars. Those are held in India, but you have to accommodate yourself.
okay, fine.
Okay.
Thank you, sir.
If I have 10 seminars, if I have 20 seminars, you can join all the seminars without any extra charge.
Okay, sir. Thank you.
I take only one's fees. After that, I teach tongue acupuncture, tan acupuncture, scalp acupuncture, all type of scalp acupuncture.
Okay, sir.
Here, Dr. Ismail.
Yes, Prof. Good evening.
Yes. Tell to my Indian students how much you are getting from me
In terms
in
of
that
knowledge,
postgraduate diploma course. Books and all things.
okay.
I want you tell them everything about me. How I am teaching, what is my experience in teaching, and what I am giving in a simple way to all of you.
Yeah. First of all, I'm going to thank Almighty Allah for giving us the opportunity to carry out this program. And I'm going to use this opportunity you give to me now to tell more about the experience and how we were being empowered in our field of acupuncture, and at the same time, the level of appreciation in this aspect, we don't know how much we can appreciate you, sir. And to our fellow colleague, our fellow practitioners in India, you have the gold under your bedroom. Let me put it that way. You have the gold, and you are not making use of it. We are now tapping the energy. We are tapping all the resources from our amiable prof. Actually, this is a great opportunity for you people that are living in India to participate in this ongoing program. And at the same time, the level of knowledge and practice we are doing in accordance with the teachings of the prof, it has given us a tremendous result. And at the same time, our patients are always happy, not even in the teaching session or the class session. Prof is always there for us to do a video call to help us manage our current patient situation at all the time. He is there for us morning and evening according to Nigerian time. Even if it is not convenient for him, it may likely be at night there in India. We in Nigeria, it may be at evening time. So Prof endure. He's striving to give us the best. He's trying to make us happy. He's trying to put all his energy to make our patient happy. So I don't know how much we're going to appreciate you, and we pray for Almighty Allah give you all the strength, the energy, and long life and prosperity. Actually, this is a kind of comment I have to give on your practice, Prof. Thank you very much. We really appreciate you.
Thank you, Dr. Ismail. So I told you who is Dr. Ismail. Dr. Ismail is a vice president in Nigerian Acupuncture Council in Abuja. And he is also president of Naturopath Council in Abuja.
Sorry, Prof. Let me put a correction here.
Yes.
I am contesting for the vice president post of Integrative Medicine Practitioners of Nigeria. The election is going to take place next month.
Okay, that is your next achievement.
Yes, Prof.
Congratulations in advance.
Thank you. Thank you so much, Prof.
So I want to share my knowledge and all the things those I have. We are not escaping anything from our students. Whatever I have, I always ready to give it to my students. So if you have any doubt, any questions, you can ask me anytime. And if you want to learn with us, then always welcome on this platform. And those are not fair with the English. I am also very fluent in Hindi because it is my native language. I am more confidence. I have more confidence while I speaking in Hindi. In English, some words I have not a good vocabulary, but in medical terminology, I learn all the words, how to use it, and when to use it. तो मैं यही कहूंगा कि जो इंडिया के अंदर हैं और वो अगर हिंदी में क्लास लेना चाहते हैं तो उनके लिए हिंदी की क्लास की भी व्यवस्था रहेगी। और हमारा कोलैबोरेशन जो है वो यूनिवर्सिटी के साथ है, तो जो भी हमें ज्वाइन करना चाहता है ज्वाइन कर सकता है। आप जितना ऑफलाइन कोर्स है हमारा, जहां भी सेमिनार होता है वहां आप अपने खर्चे पे रहना और खाना करेंगे। क्लास में एंट्री के लिए आपसे कोई चार्ज नहीं लिया जाएगा, चाहे आप 5 साल तक आप कंटिन्यू ज्वाइन करें हमें, नो प्रॉब्लम। वंस यू पे, you have lifetime achievement with me, and whatever I have new I will tell you। और जो भी मेरे पास सिखाने के लिए नया होगा वो मैं आपको सिखाता रहूं, क्योंकि मेरा उद्देश्य यही है कि हम एक्यूपंक्चर को एक अच्छे लेवल पे लेके जाएं। और मैं पूरी एनाटॉमी के साथ और उसके रिलेशनशिप के साथ ही पढ़ाना चाहता हूं। अकेले पॉइंट से कोई ठीक नहीं होता। तो जो हिंदी में क्लास लेना चाहते हैं वो भी कांटेक्ट कर सकते हैं। जहाँ शायद मधुसूदन जी हैं, आप उनसे कांटेक्ट कर सकते हैं। और क्योंकि दिल्ली का एरिया मधुसूदन जी और पूनम बहन जी देखेंगी, तो और साउथ में देयर इज माय ब्रदर एंड माय बिग ब्रदर वामसी कृष्णा, who is the owner of Vamsi TV in Andhra. He is watching my all activities through this. Brother Vamsi,
Yes, brother.
so introduce yourself. I request you.
So, hello friends. I am Dr. Vamsi Krishna, Vamsi Holistic from Hyderabad. So, I am doing regularly holistic classes, and we are also in event management. We are also in multitask. We are also in media. So, we are conducting actually regular classes throughout India. Ramesh is a good friend for me. So, shortly, we can introduce about our upcoming class, Ramesh ji.
Yes, yes.
So,
Upcoming
friends,
and all classes.
right. So this today was the third class going on, online class. So how you feel? Nigerian people, they know they are regularly with Ramesh ji. So any other people, how you feel about the class? This 3 days class, can you text? It was nice means N. Nice means N. You can text N. Right. Thank you. Thank you, friends. So
Hello,
Ramesh. Yes. No problem. Ramesh, he was a very good, knowledgeable person. Every time with me also, he used to say, so we want to share the knowledge to the people, and he want to make the therapist as a perfect practitioner. All are practicing, but his main motive was, as a therapist, you have to do perfect treatment, different type of multi-integrated, result-oriented therapies. So we are coming with beautiful and good practical oriented programs, upcoming programs. Next, thank you friends. Thank you friends. So we are coming with upcoming big programs. That also majority will be the practical classes. 1 week class will be online class. Nobody has done. He was teaching to share his knowledge to 7 days neuro acupuncture class. Tomorrow we'll share the flyer. Neuro acupuncture online class. Live practical will be some either in Hyderabad or Delhi after the completion of the class. So one more, there will be a good upcoming class, clinical acupuncture integrated with multi-therapies. So nowadays, many trainers and teachers are teaching online classes and offline classes, regular like auricular scalp. but integration practical. So the majority of the class, the flyer tomorrow I will share, the majority of the class will be a practical. So everybody knows the main theme of this class was, so his experience, his 25 years or 21 years experience, he will share directly. It was a good opportunity to grasp knowledge from Rameshji directly in Bangalore. So next month 20 onwards, so there was a 4 days full-fledged clinical acupuncture integrated multi-therapy course, integrated, I think so, around 20 or 30 therapies. He will not be teaching new people therapy. He will be teaching the method, how we will be getting good result with integration. Either it will be a scalp or auricular or Yamamoto or different type of therapies. It will be in a naturopathy or Ayurveda techniques or like that. So everything will be shared tomorrow. So please go through on that. Anybody interested? So you can contact Rameshji or me. So we'll move further. Okay. So that thing tomorrow we'll share the details. The neuroacupuncture online class and also multi-therapy clinical acupuncture Bangalore class also tomorrow we'll introduce. Okay. Yes, Ji, Rameshji, thank you.
Yes. So I tell you all about fee structure. We have a fee structure for 60K for 1 year diploma course in acupuncture, and this fees for your lifetime achievement. We are making website. On that website you can watch all our lectures for lifetime. It is opportunity for only for this 1 year for my first batch for India. I am giving this to only those pupils. Those are joining in first session of my. Okay, and this permission to you for lifetime. Any videos, any books that in my website you can free access. You have a free access for lifetime.
Thank you so much.
Okay, because I have already 60 students from Nigeria, and some I have student from Uganda, approximately 25. They have a different time, and for Indian students we are also take a different time because of communication gap. If we are all together, then it is a mix up. It is veg biryani. Because some students, those are not understand with English, then they can join Hindi classes. Okay, so fees for only one time, 60K. And in this, you can join as much as you want offline classes. And you can join our website, login free of cost. Okay. Those are interested, they contact with me, or they can contact with Vamsi Krishna. And if you have any doubt, then you can ask me freely anytime. Okay.
Hello. Hello, sir.
Yes, my sister. You call me.
I
You
have,
call me. You call me after class.
okay. No, I just want to share an experience I had with the
Okay, my
patient that,
sister. Okay, my sister. You can share. No problem.
okay. Just coincidentally, I just met him in a place, and he was not able to walk, especially lifting the right foot, and he just sat down. And I asked, I said, what's the problem? He now told me that he cannot stand for long and he cannot walk very well. So I just I palpated the UB40. He was having pains there. He said, yeah, that's exactly where it's paining him. Then UB39, I needled UB39 and then UB40, liver 3 and LI4 and then DU20. And I allowed him to sit for a while. Then he got up, he walked around, he came back. The needle stayed for like 30 minutes. I told him again to walk around after I removed the UB40 and then 39. And
My
he came
sister,
back
you
and
are
told,
forgetting that point is UP57,
okay,
not
okay,
UP40. Because I
okay,
sent you protocol, then you use it. I remember it. That is UP57. And 2 points
okay,
nearby
sir,
that, AC points.
okay. It's just below the knee, sir, below the knee.
Yes, below the knee.
Yeah. So he got a very good result and he was happy. So that's just the experience we had today. Thank you.
Thank you. So thanks to all and good night to all. If anyone have any inquiry, then he can call me on my contact number 73968 18637.
As you said, 2 hours tomorrow, sir. Are we starting at the same time, 4 o'clock?
Yes. Tomorrow also on same time.
Okay,
Okay.
thank you, sir.
Thank you.
Thank you.
Thank you.